Right, well, officials are facing calls to improve vaccine rates for whooping cough over fears that the cost of living crisis is contributing to the low uptake.
And data shows that the rates of people taking the vaccine is at the lowest level in the 10% most deprived areas in England.
And this comes after it was revealed that the UK could be experiencing its biggest outbreak of whooping cough in 2 decades.
Well, we're now joined by NHS GP Dr. David Lloyd. Welcome to the show, Dr. Lloyd. Thank you for joining us. So, very, very concerning statistics out this week. 5 babies have died this year in the UK. The UK Health Security Agency is saying there are now 2,793 cases across England so far this year, more than 3 times the amount of the previous year. What do you think is driving this?
It's interesting you talked about deprivation and its link. I think the main driver, of course, is that it's a very contagious disease, so it spreads very rapidly. And so the measures that we use to counteract COVID were also very good at keeping whooping cough levels at historically low levels as well. So during the COVID years, we had very little whooping cough. And now that we're all mixing again, and we've got this low, what we call herd immunity, then an awful lot more people are mixing and spreading the condition, which is very easy to spread, just like it is with COVID or coughs and colds or measles. It's spread by droplets in the air. So it's not. I don't think we were not expecting such a large rise in whooping cough after the pandemic.
Really? Has there also been an element of the fact that people haven't been going for their vaccinations because they're missing schedules because of the dire state of the NHS, and also a level of immigration from people who may not be protected from this disease?
So I think that one of the things that we in general practice really do concentrate on is really trying to get people in to do vaccinations. We've got two possibilities with whooping cough. We like to get our young babies over at 8, 12 and 16 vaccinated against whooping cough, and that's part of the routine system. But we've also got a good system for vaccinating pregnant women as well, so that we give the newborn babies some extra protection by vaccinating the mother as well. And that, unfortunately, is a low level. I think pregnant women get slightly concerned about having vaccinations while they're pregnant in case it may harm their baby, whereas, of course, it's the complete opposite. It's the young babies under 12 weeks, 8 weeks, that are dying because they get these terrible episodes of coughing where they actually stop breathing and they become very ill.
And Dr. Lloyd, I spoke to an NHS doctor on Friday who was trying to raise an awareness project in West London, and she did say that there has been a difficulty with people who've come to the UK from other cultures, other countries that don't have that heritage of vaccination. They don't have that in their country. And an astonishing statistic that leapt out is that 51% of the cases that we're talking about here today are children aged 15 and older. These aren't babies. These aren't mothers who've been vaccinated to give birth to safe children. These are teenagers, and many of these have come in from other countries, and therefore they don't have that culture. How do we get to those people? They're very stubborn to reach.
So if they register with a GP, which I hope they will do, and we certainly would offer no barriers to that, the preliminary checks we'll do will check the vaccination histories of all our new patients and make sure that they are vaccinated and kept up to date. Because incomplete vaccination schedules, as you say, put people at greater risk. It's a horrible condition to have as an adult or as a 15-year-old, but it's not going to kill you. But you do cough for months and months and months and retch and vomit. And it's not a pleasant condition to have. But getting those pregnant mums vaccinated and getting those early courses started is the key to avoiding death.
OK, and I want to ask you, Doctor, what are the sort of very earliest signs of the illness and what is the treatment for it?
Well, a very good question, because in fact, just like measles, just like coughs and colds and viruses, it doesn't look any different in the first few days. It's really about day 14 that one begins to suspect it. But traditionally, we've been very bad at diagnosing whooping cough early on in the condition. I was at a course the other day and he said, well, if you haven't diagnosed a case of whooping cough in the last year, then you've missed at least one. So it's day 14 that's the key time. But the trouble is it's day 21 that you then can't do anything about preventing the spread. We really like to get antibiotics in early to prevent the spread. It doesn't do much for the illness, but it helps prevent the spread and avoid vulnerable people getting whooping cough as a result of that case.
And the treatment for it?
So there's a common antibiotic we use for treating coughs and colds, which will reduce the infectivity of people with whooping cough, but it doesn't do an awful lot of good, I'm afraid, for the symptom.
Wow. OK, Dr. David Lloyd, thank you for sharing your expertise with us this morning on Breakfast.